My name is Kristen Rivera, and I'm going to be doing my presentation on hypoglycemia in patients with diabetes. This would be a presentation that I would give to someone who is newly diagnosed with diabetes, their family and friends who might be taking care of them. The American Diabetes Association estimates that 25.8 million children and adults in the United States currently have diabetes. This is equal to 8.3% of the population, so it's a huge number. Of all these people, all of them at some point or another will experience a hypoglycemic reaction. So what is hypoglycemia? The JDRF, or Juvenile Diabetes Research Foundation, defines hypoglycemia as having too low of a level of glucose or sugar in your blood, which occurs when a person with diabetes either injects too much insulin, has eaten not enough food, or has exercised without consuming extra food to cover the exercise. It's important for someone with diabetes to know the signs and symptoms of hypoglycemia because this can quickly progress into insulin shock or a severe hypoglycemic reaction, which is a medical emergency. So back behind me, I have made a poster that shows some pictures of some of the signs and symptoms of hypoglycemia that are common. The first one is shakiness. The person who's experiencing hypoglycemia could also have some dizziness, complain of extreme hunger, just an anxious feeling, maybe having some vision changes, blurry vision, just feeling a little dizzy. There can be some sweating. Fast heartbeat is common. Just being really weak or tired, fatigued, a headache, and just being irritable. Many people with diabetes who are having a hypoglycemic reaction will totally go out of character. If it's a child, they might throw a temper tantrum for no good reason. So this is a really good indication that a hypoglycemic reaction might be happening. So once we've identified that we're having a hypoglycemic reaction or think we're having a hypoglycemic reaction, it's important to test the blood sugar to confirm that that's actually what's going on. Once you test your blood sugar, if it's reading under 70, that's a clue that hypoglycemia is what's going on. At that point, you're going to need to take action to correct this hypoglycemia and get back into your blood sugar range. The best course of action is to get something and ingest it that has a fast-acting source of carbohydrates. So you want to get the sugar so that your sugar goes up. Some really good things to use for this would be a juice box. They actually make some glucose tabs that you can buy at the store specifically for diabetes. Sucking on a hard candy, those are all great. Once you've done that, you want to wait about 10 to 15 minutes and then recheck your blood glucose level with your meter to make sure that it has gone up into the safe range of about 70 to 100. Also, like I mentioned before, insulin shock. If you don't recognize any of these symptoms, you could actually go into what's called insulin shock. This usually presents where the patient's blood sugar is so low that they'll either pass out or begin to have seizures. In this case, the juice box, none of that will work. So what you're going to want to do is get out your glucagon injector. This is something that all diabetics should be carrying with them. Once you open it up, you'll see that there's a powder and a liquid part. You're going to want to take both pieces out. You're going to want to inject all of the liquid into the powder. You're going to want to roll that around until there's no more powder left. It looks completely liquid. At that point, you're going to want to reinsert the needle, draw all of the liquid out, there's two lines on this injector. I don't know if you can see them, but right here is the 0.5 milligrams, and then right there is the 1.0 milligrams. 1.0 would be what you would use for an adult, and the 0.5 would be a children's dose. But you can never overdose on glucagon, so if you're unsure, inject as much as you need, or you think you need. And this is just an injection that would be given to the hypoglycemic patient, just like an insulin injection. And probably the most common or easiest place to give it would be in the patient's thigh. So that being said, hypoglycemia is something that happens all the time or quite often in patients with diabetes. And it's really, really important to know these signs and symptoms of early hypoglycemia so that you can avoid the emergency situation where you're going to have to use the glucagon pen, call 911, and be transported to the hospital. Thank you.